Welcome to the Human Momentum Podcast. I'm your host, Erik Schabert. I created this podcast to leverage 12 years of osteopathic medical training and over a decade of experience in primary care medicine to help sort through the confusing and sometimes contradictory health information found on the internet. I want to distill all this information down to a form that you can use every day to optimize your health as you move forward through life. So if you are looking to get to life's finish line with the ability to do the things you love intact, then this podcast is for you. If this is your first time here, please don't forget to smash the subscribe button and throw us a like as well. It really helps us get this information out to more people. With all that said, let's move on with today's episode. Hello, and welcome to this Sunday special edition of the Human Momentum Podcast. Today I am here in response to some comments that requested I do a little bit more of a deep dive on alpha-gal syndrome and the Lone Star tick after my recent video. Well, let's start by talking about alpha-gal syndrome itself. This is a condition that is caused when the human body starts making antibodies to a complex sugar called alpha-gal that is present in most mammals and as such is present on most red meat. It also happens that this complex sugar is present in the saliva of Lone Star ticks, and therefore there is some potential with repeated exposure to Lone Star tick bites to develop an antibody to alpha-gal and therefore end up with alpha-gal syndrome. The CDC states that there have been 110,000 reported cases that they strongly suspect are alpha-gal syndrome. Of those, around 93,000 or so have had confirmatory blood tests that nailed down the diagnosis. The rest did not have testing, but the clinical course and clinical picture fits fully with alpha-gal syndrome. The CDC also estimates that the disease is grossly underdiagnosed and that there have actually been 450,000 cases since 2010, and the discrepancy in diagnosis is basically due to the fact that there is not as wide an awareness and has not been as wide an awareness in both the medical community and among the general public as there could be. So very frequently when alpha-gal is present, it just isn't suspected. This is gradually being less and less common, and we are starting to suspect it more and more, which may be part of why we are starting to see more cases now. To give a little bit of the history of alpha-gal, it was first identified in 2005 as a side effect of receiving the cancer drug cetuximab. It turns out cetuximab had a side chain that very closely mimicked the alpha-gal sugar, and there were some instances where individuals began to make IgE, a type of antibody, to alpha-gal. The result was they became very sick when they consumed red meat that had the alpha-gal sugar on its surface. Alpha-gal syndrome was first linked to the Lone Star tick in 2009 by some very clever researchers who began seeing cases of alpha-gal in individuals who had never received cetuximab, and they were able to link these cases to Lone Star tick bites. And as such, with further research on the Lone Star tick itself, we found the alpha-gal present in their saliva. And then we were able to, with further research and further surveillance, nail down that this is indeed what was causing alpha-gal syndrome in those individuals. Some of the characteristics of the disease that make it very difficult to effectively diagnose: first off, the reaction to red meat develops weeks to months after the tick bites. And then the reaction to red meat, once it is present, we're talking about consuming a red meat meal and then getting sick 2 to 6 hours later. This is a much longer delay than most hypersensitivity reactions. For instance, someone with a peanut allergy consumes peanuts, they become sick very quickly, within minutes. Whereas with alpha-gal, a red meat meal will generate illness 2 to 6 hours later. That does make it a little bit tougher to diagnose because people are reluctant to ascribe a cause to something that occurred so much earlier and may not even think of reporting it to a physician who's evaluating them. The symptoms of alpha-gal syndrome, I did talk about this. They're intense GI symptoms primarily. Nausea, sometimes vomiting, diarrhea, intense abdominal pain. You can also have shortness of breath, hives, generalized itching, and you can have it progress to full-on anaphylaxis, which will result in system-wide allergic reaction that can crash blood pressure and cause multi-organ failure, resulting in coma and death. And that is what happened to our individual in the case study I referenced in my short video. We have seen alpha-gal becoming progressively more common as time has gone on. We believe that this is due to a couple of factors. First off, we are seeing increased awareness amongst physicians, increased awareness amongst the general public, and therefore more people are thinking to get tested and thinking to test for alpha-gal syndrome. Therefore, we're catching more. Additionally, I think another one of the factors we have to consider is that the numbers of the Lone Star tick are being reported as increasing. We think this is due to consistently more mild winters in much of its range. It also has expanded its range, pushing further north. And again, this is more than likely due to warming temperatures. Well, alpha-gal syndrome isn't the only problem that the Lone Star tick can cause. It also carries several bacteria and a known virus. The most common bacteria for it to carry is one called Ehrlichiosis, and this is the cause of human monocytic ehrlichiosis. This is a syndrome that is similar to Lyme's disease in that it will cause fevers, generalized muscle and joint pains, headaches, sometimes with nausea and abdominal pain, but frequently without. And there can be a rash associated with ehrlichiosis, but it is much less frequent to have a rash with Ehrlichia than it is with Lyme's disease. With Ehrlichia at primary onset, you can get what they call a petechial rash, which is a lot of little red spots where blood vessels ruptured very close to the top of the skin. It will not feel raised. You'll just see a diffuse red spots across the entire body. You also see a diffuse maculopapular rash at times. This is a bunch of red splotches of different sizes that are flat, not raised, and do not itch. So if you see any of these constellation of symptoms after you've been out hiking and may have been bitten by ticks, definitely get to a doctor. We can confirm the diagnosis for Ehrlichia with a blood test, treat with a doxycycline antibiotic for 7 days, and it will resolve the condition without any further issues. Ehrlichia does frequently resolve on its own, which is why, even though we think there are anywhere from 3,000 to 5,000 cases of Ehrlichia nationally every year, we don't think a lot of them get reported. And the actual number reported is about a third of that. And that's probably, again, because this is self-limited. And it may actually be even much more common than that. But we don't see a lot of reports because a bunch of it is self-limited. There is also a virus transmitted by the Lone Star tick called Heartland fever. This is an illness that causes a syndrome very similar to influenza without the respiratory symptoms. So generalized aches and pains that can be quite intense with a fever that can spike above 101 and sometimes GI symptoms as well. The good news is the illness is overwhelmingly self-limited, meaning it will go away on its own. But if it's very intense, if you're having trouble keeping fluids down, you do need to get into a doctor and get some IV fluids, maybe get some pain relievers, and just have them help you get through it. The third and final illness I want to talk about is tularemia. Tularemia is another bacterial illness that is treatable with antibiotics. The difference is if you contract tularemia from a tick bite, you will get an open sore at the site of the bite. And then usually around that area or upstream of it, we'll see swollen lymph nodes along with fevers and chills and body aches. This again can be treated with antibiotics if you get it. So please do see a doctor if you see an ulcerated skin lesion and swollen lymph nodes after a tick bite. All right, and finally, I just want to very briefly touch on a couple of illnesses that are spread by the deer tick, or otherwise known as the black leg tick. This is a tick that is present through the entire eastern half of the United States, and you can see its range here. And we know it so well because it spreads a bacteria called Borrelia burgdorferi in some very specific areas of the country. Borrelia burgdorferi is better known as Lyme's disease. The Northeast and the upper Midwest are the primary areas where you see this particular bacterial illness spread. As you can see from this image, we do see rare cases outside of it in the rest of the tick's distribution, but it does tend to circulate in the tick populations in very specific areas of the country. And the final bacteria is one called Anaplasma phagocytophilum, causes a condition called human anaplasmosis. Anaplasmosis presents almost identically to Ehrlichiosis. It's a very similar disease, also detectable by a blood test, and it can be present in a wider part of the range of the blackleg tick, as you can see with this image. So if you're in any of these areas and you may have been bitten by a tick and you develop Lyme's-like or Ehrlichia-like symptoms, anaplasmosis is also unlikely to produce a rash, but it does kind of get the rest of the syndrome. So, and it's also treatable with doxycycline. The bacteria itself is very similar to the one that causes Ehrlichiosis. Well, that is my wrap up on tick-borne illnesses. I hope you found this informative. Please, if you're going outdoors anywhere in the country that there's ticks, which is actually most of the country, we have one species or another that can carry one illness or another. Please do cover up and use insect repellents that have the potential to repel ticks. You will not regret preventing a tick bite. I hope you found this informative. If you did, please do like this video and subscribe to the channel. It really does help me get stuff out to more people. And if there's anybody in your life you think could benefit from this information, please feel free to share the video with them. It really helps me. Thank you so much, folks. And I'll catch you next time.